Welcome to tonight's community forum. I'd just like to begin by acknowledging the traditional custodians of the land on which we're all gathered and pay my respects to elders past, present and emerging, and any First Nations people that are in this meeting today. My name's Matt Sharp. I'm the Chief Executive of Goulburn Valley Health. We have a slightly different forum tonight compared to what we ran earlier in the week. We will provide some brief information about the outbreak and where things are placed shortly. That'll be done by myself and Paul Johnson, who's with us again. Tonight's forum, though, will have a more of a focus on emergency relief and support arrangements that are in place for people in the community at the moment. Obviously, we know that with around about 16,000 or so people quarantined at the moment, it's really important that there's a response in place to make sure that people in the community can get the support and assistance that they need. So on that note, we will have emergency management response contribution from Deborah Abbott, who is the Deputy Emergency Management Commissioner from Emergency Management Victoria. Merrin Bayment, who's the Deputy Agency Commander from the Department of Families, Fairness and Housing. And then we'll also have a local government response by the CEO of the Greater Shepparton City Council, Peter Harriott. Again, we do have some people also in the room in the Zoom call that are able to respond to any questions. We've got Paul Johnson, who's a Professor of infectious diseases from the North East Public Health Unit in Melbourne, Felicia Dean, who's the CEO of Brumbalara Aboriginal Cooperative, and Chris Hazelman from the Ethnic Council in Shepparton. So that'll be the run through for how we'll proceed. We're going to move through the speakers as quickly as possible so that we can allow enough time for people to be able to ask questions and to be responding. So on that note, we are using only the live stream feed for public audience tonight. We're not having the combination of Zoom and also in terms of Facebook that we ran earlier in the week. So any questions that people have, please use the Facebook function to actually put questions or comments, and we'll be able to respond to them from there. In relation to the outbreak itself, we know today there was 76 active cases that was reported earlier in the day publicly. Since then, there's been some more people testing positive. We've had the results coming in during the course of the day. So from that perspective, I guess it's really important on the high number of active cases we have at the moment, and in fact that there's people still testing positive, that anyone who has any symptoms of COVID-19, no matter how mild they are, that you go and get tested straight away. What we're actually seeing in relation to this outbreak is that people are testing positive with COVID that have the most mildest symptoms. So please don't delay, please don't put it off and think that it's just a cold or it's just a bit of influenza or something like that. Given what we're experiencing at the moment, there is a very good chance that it could be COVID. So don't delay and put it off. There's plenty of access to testing right across all the sites that we have drive-through access. So please don't put off getting tested. We're also wanting people from any of the exposure sites that haven't been tested yet to get tested straight away. The number of exposure sites are still continuing to grow. So please, again, keep an eye on the Department of Health website for all of the exposure site details and come forward and get tested as soon as you know that you're have been to an exposure site. Pleasingly, we've had a high number of people come forward for testing. Over 21,000 people so far have been tested for COVID-19 since last Friday, which is a pretty enormous effort. That's around 44% of the Shepparton and Mooroopna population. But as I said before, it's not enough. So don't hesitate at all if you've got any symptoms, and come forward and be tested straight away. So without delaying things any further, we do, as I said before, we know we've got around about nearly 4,500 or more people that are considered to be primary close contacts. We understand that there's around 16,000 people or more that are currently in home quarantine. And hence, that's why the focus of tonight's forum is really going to be around emergency management and support arrangements. So with that in mind, I'd like to introduce our first speaker, Deborah Abbott, who's the Deputy Emergency Management Commissioner for Emergency Management Victoria. Thanks, Deb.
And thank you, Matt, and good evening, everyone. I want to thank Matt for inviting me to this forum and having the opportunity to talk to you. EMV is on the ground in Shepparton, and we're here to strengthen support for local services and networks. I do want to thank those organisations and agencies in the local community for support. We work together. We actually can't do it without you. The situation, as with all emergencies, is always evolving, and we're always constantly addressing the risks and what's needed to meet these emerging challenges. As you will have seen, the ADF is providing support. There is 80 ADF personnel that are deployed to the Shepparton area. Now, they're doing a variety of tasks. And when we work together, we actually can't do it without Sorry, I was getting some feedback there from the machine. So if I could just say, the ADF, they provide us with a variety of tasks. It's not just in relief services, nor is it just in testing, but we have worked with ADF for a long time, and they've always been a support agency for us within emergencies. And we do thank them for the support and ongoing support on the ground here today and responding to this emergency in Shepparton. If I could talk to one of those risks that we're really addressing, and what is probably the key focus for emergency response from EMV at this time, and that is the relief needs. And I know this affects so many of you directly. We do work with all the agencies, as I said, on the ground. So there's been a huge amount of effort already gone in, and that combines local council. They play a huge role in emergency relief. And they do this even outside of emergencies. They're always with us in providing relief services to Victorians, and Shepparton is no different. Supporting those local council workers and the agencies that combine in is a number of volunteer agencies, not-for-profit, non-government organisations, and again, they've always been there for us. And the local community and the local services, they have the knowledge and capability and what it is that really makes delivery of relief more personalised and more appropriate for local community. So if I could just really make the point that EMV doesn't come in and tell local networks what it is that, how they should be treating their community. We have to work in with them because all those networks are really firmly established. So it is very much around support into those existing systems. I'll talk to one area where it is that I think we're making a difference. So as I've said, we've got ADF on the ground. So the response that we can provide is we help with coordination. So at present, we've got ADF working directly with Red Cross and also with Goulburn Valley Care, so GB Care, a range of transport and volunteer networks. And if I could do a bit of a shout out to Gattuso, who is providing us with direct facility support and transport support. They're all working together, and already yesterday we delivered, we commenced operations there. We delivered 50 food packs to houses within the Shepparton area. Today we delivered 500. Over the weekend, we'll be delivering an additional 300 each day. These packs last for 2 weeks, and they also have within them not only staples around dry food and other perishable goods, but they also have hygiene, personal hygiene, and other sanitary need goods that help get families through these difficult times. As I said, these care packs are just one of the support that is provided. And these numbers, they go hand in hand with what all these other agencies are also providing. So as you can see, we provide this sort of bolstering support and draw in our coordination expertise to lift up and optimise the systems that are already in place. We're also working really closely with the food and grocery sector. So supermarkets, they are open, they're well stocked. Coles, Woolworths and the IGAs, they've all opened up more delivery windows, and that includes online services. They're also drawing staff from outside of their Shepparton area and using those workforce bolster again to help with stacking of shelves and providing support within their stores to get services that are at the front of house supermarkets there. Again, what is key to supporting a community is the support the community provides and the resilience that's provided itself. So the community, and by that I mean supporting your neighbours, the relief that comes from family, friends, picking up goods, be it pharmaceutical supplies, picking up groceries and dropping them on doors where people are having to isolate. All this goes together to build that broader community resilience that helps a community when these times hit them, be it a flood, fire, pandemic. That's what's actually at the base of all of the support that happens in relief. It always grows from community up. The other parts that we bring in just supplement that and also help us draw into where we have the greatest and most urgent need. If I could talk about the role of EMV more broadly, EMV really takes into account priorities, and again, it's in a state context. So we also have to make sure that we also look at all these response activities that are going on. And you've already heard around some of the public health response. Response, relief, recovery, preparedness, they're all arms of emergency management. Again, we rely on the broader network and working together in order to provide those essential services. There is careerists, there's volunteers, but emergency management is built on working together, and particularly in Victoria. And we learnt those lessons a long time ago from some of the savage fires that we've had. It's how we work well, and it's how we work best. I know that people are self-isolating and they do need assistance. The City of Greater Shepparton is providing a wonderful website that provides lots of information in order to seek relief and also understand what's available to you and where to go. Please access that, greatershepparton.com.au. Referrals for complex cases, they go through a hotline, and there is key hotlines. The Department of Health hotline, which is that 1800 675 number 398. 398. Option 4 directs you to relief. And again, the Department of Health have been working to pull down the wait times on that line. More people have been put into the call centre to answer those calls, and again, hoping to make sure that you get your needs there as quick as possible. Probably finally, Department of Families, Fairness and Housing, they are the lead regional coordinator for relief services, and they work closely with Council. As I said, working with ADF, Red Cross, Council, Goulburn Valley Health, local community service organisations and EMV, all working together We know, I also want to acknowledge, we know people are anxious, we know people are concerned, and we know people are worried about how it is they're going to support their families, manage through this pandemic. These are challenging times. It's challenging times for our state. Again, we can only pull together and make sure that we work virtually as one in order to meet these challenges. We will get through this. We will get through this, but it's not to say that we're not going to have challenging times ahead. And we've been in this now for a while, and please, if I can just say, we are working so hard. We are working so hard to help you. Your community is a great community. They're a wonderful community. I've seen how much you're pulling together. Just keep doing it, because it's the only way we're going to get through this. And thank you.
Thanks, Deb. Thank you, Deb. And apologies, that was me trying to get the Facebook feed that interrupted you before, just so I could monitor the questions. So our next speaker is Merrin Bayment, and Merrin's from the Department of Families, Fairness and Housing. And Merrin's going to talk about more broadly what is available in terms of relief and support, including food packages and the like. So over to you. Thanks, Merrin.
Great, thanks, Matt, and thank you for inviting me to speak tonight. I'd like to acknowledge the traditional owners across the state, that a lot of people are coming from you today, but particularly on your lands of the Yorta Yorta people, and pay my respects to elders past, present, and any Aboriginal people with us today. Support is available, as Deb said, in your community for food, material aid, or any assistance that you do need. And please don't ever be embarrassed or concerned to ask or reach out for help. From experience, and I have had to do lockdown and be quarantined for a good 3 weeks, and it's not an easy time. So don't be afraid to reach out. It is hard to get support, so please reach out to us, and we're very willing and able to support you and your families. And even if you've had one of the food packs, and I'll go through what they are including, and I won't talk for too long, but if you've had it and you've got a growing 14-year-old boy, please feel free to call back and say that you need some additional support. It's never too much to ask, so please do reach out to us. A strong focus of the agencies, and we're very aware that this is a very diverse community, and so we need to make sure that we are addressing the whole community's needs. So I do want to reiterate that there is culturally appropriate food for people, and we're working very closely with the Ethnic Council of Shepparton and centrally with our Victorian Multicultural Commission to access the right foods. And today we've had a fantastic offer of support from the Halal Food Bank in Melbourne, who's going to be doing a delivery this weekend for particular food. So, the support from Melbourne, as well as the incredible support that is your local community are providing, is absolutely present. It is really important, with 16,000 people in isolation, it's incredibly important that you do stay in isolation, and that's why we really want to provide the support to you and to deliver food and essential needs to your home. And obviously, when the teams are delivering food to your homes, we really need to make sure for their safety and yours that it's all contactless and safe, COVID-safe practice. So, please reach out for help. And I'll reiterate the number again. I know Deb gave it to you, but it's 1800 675 398. And again, 0 for an interpreter, 4 and then 4 again for support. And I know there were bumps in this road of the 1800 number over the weekend, and there were long waits. Please be very assured that today an additional 50 staff were provided to the 1800 number. And I almost cried this afternoon when I heard there was no wait. So please do call and ask for support, that the call is there for you. We're also able to support people with particular complex needs. So Again, going through that 1-800 number, please do reach out if anyone has particular complex needs or urgent needs. So it might be a script or a pharmaceutical need, or urgency for formula or nappies or those kinds of things. Please do reach out, and we can change the order to being quite an urgent response. We also, for cases, we are able to support people with recovery, because recovery from COVID is long, and we know that there is community concern about COVID. So please, if you're struggling with recovery and you've had COVID, please do reach out. There are ways that we can support you. On our website as well, the coronavirus.vic.gov website, there are a range of other supports. So there are financial supports for people who need to isolate at home, or so again, jump onto our website to have a look at that. And I believe the team's going to add that into the chat. Again, mental health supports, doing lockdown, long quarantines. Let's be honest, the last 18 months has been pretty tough for our Victorian communities. So don't hesitate to put your hand up. And again, on our coronavirus website is a range of services and mental health supports. But, you know, keep it local. Your community has some amazing organisations and community service organisations. So please don't hesitate to reach out to them. So I think Deb sort of provided all the numbers. So an incredible amount of work, and the Australian Red Cross packs, so over 900 packs since Sunday, which is a pretty phenomenal effort. And so just to note, those packs feed a family of 4 with sort of staples for 14 days. But again, being a mother of a growing 14-year-old, I know that they eat. So please don't hesitate that if you need additional support, it is there. There are an incredible amount of other organisations, and I know I'll miss some, but I'll just name a few that you can reach out to. So the GV Lighthouse, through their GV Cares, has done an amazing job in collaboration with council. Food Share, again, doing an amazing job, and I'd like to shout out to Oz Harvest, who delivered 20 pallets of food into Food Share today, and ably supported by so many volunteers who are helping either deliver food or pack boxes and do an incredible work there. Salvation Army, Rumballara, the Primary Care Connect team, Pod Studio, Casala, you know, amazing community support, and I know I will have missed some, so if I did, I apologise, but incredible effort. So the other thing to note is I'd really like to do a shout out. So the emergency management team and of DFFH has established on Saturday the Regional Relief Coordination Committee, and we report up through to EMV through the structures of emergency management, and it's very ably chaired by Linda Shields, and some of you will have known her from a local community member who's been a long-standing resident, doing an incredible work of pulling together Kay from council and all these amazing communities to support all your needs as we go through. The other thing we are establishing is a sub-working group of that committee to make sure that we are addressing the needs of our culturally diverse community. And so with along with VMC and Chris, who is also on this chat from the Ethnic Council of Shepparton, we will be meeting every couple of days to make sure that if there are any particular needs or gaps, that we are addressing those. I'd like to do a shout out to Regional Development Victoria and the Department of Jobs, Precincts and Regions, who have done an incredible amount of work working with our supermarkets. So, you know, I heard a stat that Woolies had a 350% increase in their demand for online services, and lost half their staff, who are also parents of kids in the school. And so, you know, they have now really done an incredible job to open up their online services, as well as Coles and Aldi and local LGAs and Foodworks, to do an incredible job to now really increase that response, open up online, delivery of some supports through to Food Bank and others to make sure that there's enough food in the town. And I understand even SPC and others have also, even though they've lost food workers as well for furloughing, are also supporting those activities in the town. So again, just to reiterate, please reach out. The 1-800 number's there. I'll hand over to Kay and Peter from Council, but we are here to help. And any questions, or if you're aware, I noticed in the chat that some people had missed out, please call us and we will make sure food is delivered to you. And if there are any particular needs, you know, most of you will have been in quarantine coming up to a week now. The kids are probably getting frustrated, and I think at the relief meeting tomorrow we might need to start thinking about what are some things we can do to support online activities and those kinds of things. So again, thank you to everyone. Thank you for your time, and back to you, Matt.
Thanks, Merrin. It's really good to see the questions coming in the chat. I've been typing, jotting down a few notes as they've been coming through, and we'll get to those questions shortly. A shout out too as well to Linda and Lisa, our Auslan interpreters, who were with us again tonight from Tuesday night. They're doing a terrific job, so well done, and thanks to Linda and Lisa. So now we'll move to Greater Shepparton City Council. I'm not sure, I think it might be Peter Harriet who's coming off mute, who Peter's going to do the talking. So Peter Harriet, CEO of Greater Shepparton City Council, over to you. Thanks, Peter.
Good on you, Matt. Could I support your acknowledgement and Merrin's acknowledgement as well? Merrin and Deb have stolen my script, so that's good. There's more time for questions, but really, I just wanted to do a shout out to the community, to our audience here tonight, to let you know that there is a superb effort underway, a very professional effort underway, and that your community is in the best of hands. And I'm not talking about the council response at all. I'm talking about other things now. Merrin and Deb have mentioned a fair few of them, so I won't repeat those. But I will go to Goulburn Valley Health team and Matt Sharp. Just an incredible response that Matt and his team are providing. We know that health services are important in a normal situation, but when you get into an emergency, you really understand that they're the lifeblood of the place, and absolutely superb support. Now, Matt encouraged everybody to go up and get a swab and get that shoved up your nose and get a needle shoved in your arm. I've done both those this week, and the additional benefit of doing all that is you get exposed to an absolutely energetic and motivated team, whether it's at the testing stations or at the vaccination centres. Those staff just make you feel like life's worth living, and so just for that reason, go up there and get a dose of really good mental health in you, and it just reinforces the work that is being done by Goulburn Valley Health. So well done. The school community, obviously this has hit hard to the school community, so a big shout out to the principals, the teachers, the students, the parents, the support staff. Hang in there. We are getting there and we will get to the end, but your work in quarantining and isolating is really crux to solving this problem and this emergency, so hang in there. The businesses obviously doing it incredibly tough, and you need support. Now, I know there's additional forums on Monday being held through Matt Nelson and RDV, so look out for those. We've mentioned the state government support. That's been very good, and the additional support through EMB and Deb and crew, and ADF. Yeah, great to see the ADF in town, just doing their humanitarian work as they do so superbly. Smile on their face and just do whatever they need to do. So great work. So please, community, be reassured that and be proud of the response that is being given by your locals, whether that's your local hospital, your local community services, Lighthouse and Food Share were mentioned before. There's many, the Ethnic Council, the multicultural cook-ups that are going on. It's endless. I'll pull it up there. I just note that, yes, we will miss something. Someone will not be satisfied with a response, or you can't work out a 1-800 number or whatever. So I'll give this a plug. This is now on our website. It's just an additional piece of information. Look after ourselves and others. It's got every phone number you need in there. If you can't sort out your problems from that one, I'll go he. And I'll now hand over to Kay, our Director of Community Services, and also our Municipal Emergency Manager, who's doing some great work. Over to you, Kay.
Thank you, Peter. I think you've covered a lot between Deb and Merrin and yourself. I don't have a lot to add. I suppose a couple of people have asked me where does local government fit into an emergency. It's quite clear under the Act that we have two main roles. One is to assist with resources, and you'll see that with buildings, with the Macintosh Centre being used as a vaccination centre hub, and then we've got the Rec Reserves, Sports City, Mooroopna, and others that are being used for testing. Also, we've resourced our events team, who have done a magnificent job to help get up all of those marquees, work with local businesses to help us with those marquees, and also work with the traffic management teams that have been working tirelessly over the last week and a bit. So that's our first job in emergency management. Our second job, as we've heard, is to work in relief and recovery. So every day since this started, we've been sitting in many meetings, talking with others, all of our partners, about relief coordination. We weren't ready for so many people to be in isolation, so it took a couple of days to ramp up that response, but I think we're getting there now. And as you heard from Merrin and Deb, the supplies that are coming into Shepparton now are wonderful, and with our partners, our service partners and our volunteer partners, we are delivering those food packages and delivering a lot of services in the background as well. I know Primary Care Connect have a great little service called Check and Connect. Check and Connect is not a counselling service, it's just a phone call service. So if you want to go onto the Primary Care Connect website and list yourself as someone who requires a Check and Connect, you can get a phone call every day just to check on you and say, are you okay, and what's going on today? The Primary Care Connect team have got resources behind them. So if things escalate for you while you're in isolation, they can put in extra resources for you. So we do have a lot of services out there that are looking to help you as best we can through this time. I know that sitting for 14 days is extremely difficult, and we need to understand if there's any gaps there that we might be able to fill. Peter also stole my thunder with our new newsletter. So, but our new newsletter is on our website. So greatershepparton.com.au is our website. You'll see a flash of yellow at the top, and then in green it says COVID-19 information. So you just flick onto the COVID-19 information, and under there you can find out where the testing sites are, where the exposure sites are, how do you access food, current changes, current vaccine information. So it's all on our website, and we're updating that as best we can. There's also a section in there on translated documents. We have both written translation and verbal translation to assist as best we can with any sort of understanding in that space. So I suppose the other thing that we just want to say is we're doing a lot of case management as well. We understand that this is a difficult process to navigate at times. So if you are just overwhelmed with trying to navigate this process, please call our customer service line, and you will be put towards one of our case managers, and we will do everything we can to help you. It may just be a phone call to help you understand how to get through the 1-800 number. It may be more than that. So Greater Shepparton's our customer service number is 0358 32 9700. So if you are overwhelmed and you think we can help you somehow, we will do our best to do that. So the other thing that we are recommencing is a recovery committee. That's also part of our role. So there's already 36 agencies that met on Tuesday to start to think about recovery. So it is going to be here. It won't be that far away, and we are starting to plan for recovery. So from Greater Shepparton and the people that I work with, please hang in there, those that are in isolation. We certainly are thinking of you, and we want to do everything we can to help you. For all of the service providers and the volunteers and the charities out there that are working and rallying to put together the best service we can, I thank you as well. So I'll leave it at that. Thank you.
Thanks, Kate. We might get, I'm not sure if it's John or Merrin, maybe someone in the next, because we've still got plenty of time available. If we could just put a summary in the chat or a comment on Facebook about where people can get the access they need. I can see from the feed that people are responding and sharing really helpful and valuable information, which is good. But I think in terms of certainly the 1-800 numbers that have been referred to and where people can access food drop information, all of those sorts of things, if we could have a summary that's put into the feed, I think that would be really helpful, just so people can go back to it and have it in one concise place. I've got a couple of questions. Paul, I might get you ready to come off camera, because there's a few that I've just noticed coming through in the chat. One of them I can answer in relation to day 13 testing and how our planning is going in relation to that. So the team back in Melbourne at the Department of Health and our local contact tracing team are really starting to gather together really valuable information about the number of people that are going to need to be tested on day 13. And that information we will share through the GV Health Facebook pages. People will be contacted directly in regard to that. In terms of will we have enough capacity in relation to the testing that's in town, the reason why there was longer waits a week ago now was because we had to stand up the service so quickly, and it took us time to mobilise resources and people out of other areas. As I mentioned before, we've tested now over 21,000 people in a week, which is a pretty, I think, remarkable effort. So that planning is going to be done. We've already started that, and we'll have a very clear idea of the number of people that are going to need to be tested each day. And we're also now looking at load levelling systems or ways to make sure we balance that out across all of the testing sites. On top of that, we've also got the ADF personnel in town to boost the resourcing from that perspective. So we'll provide all of that information as well. Paul, there's a couple of questions in relation, and I apologise, we didn't get to this earlier in the week, is it's going to be difficult to provide specific advice, but in relation to circumstances where there's joint custody arrangements across two households, in the circumstance, I think more it's in relation to where people are primary close contacts and they're required to isolate. But how should people approach movement between households in relation to shared custody arrangements or those types of circumstances where children may move between two houses?
Okay, thanks, Matt, and good evening, everyone. So there's a couple of concepts which I'll try and explain. So that a primary close contact is the person who's been exposed to COVID, and we're waiting for their quarantine time of 14 days to make sure that no virus is going to develop. And after that time, if they don't develop it, they probably have either killed it themselves very quickly without ever developing an infection, or more likely weren't exposed at all, but we can never be sure until we wait that a period of time. Now, because Delta moves so quickly, and very often once one person in a house has it, everyone else has it pretty soon after, we ask people who have a primary close contact in their house to quarantine with them. Because if they were going out to work and then that primary close contact person developed COVID, they are quite likely to transmit it in the 2 days before they get symptoms, and we wouldn't know. So we'd create a whole lot more exposures by those people going out. So that's why you're all together at home. Now, if in a split family situation, the primary close contact, which by and large is the children from the schools, that's the most common category, goes to one house or the other and then stays there, and then is tested negative after they separate. Now that doesn't have to be at day 13, it can be day 1, 2, 3, 4. If they separate and go to one house, test negative, then the other people in the other house are basically just citizens again, because there's no more risk there. So that's one way of dealing with that issue. Another, if you're in a situation where the primary close contact has been going backwards and forwards between the two houses, well, that's not really supposed to happen, because the primary close contact is supposed to be fixed in place. When you're in quarantine, you're not supposed to go out, and other people shouldn't be moving around. So strictly speaking, that shouldn't arise, because you're supposed to quarantine with those very few reasons to go out, which is emergency, medical emergency, family violence, those sorts of things. But other than that, you stay there except to be tested until you're released. So that's, I hope that kind of generally answers the question, that once you've separated from a primary close contact who has then, after the separation, tested negative, the household which no longer has that person in it has no more risk than the background risk that we all have. So you then just go back to that situation where anyone with symptoms, anywhere, anytime, comes forward for testing. Matt, can I just check in with you that seems to answer the question as you understand it?
Yeah, I think so. And it's difficult. I mean, it's a general explanation, and everybody's circumstances will more than likely be a bit different. And that makes it a bit hard for us to provide that advice more broadly. But hopefully, if that hasn't clarified things, maybe if people are comfortable to, only if you're comfortable to, just pop a clarifying question in the comments, and we'll see if we can get to it as well. Kay or Maren, the other thing we might add just to that list of information, I saw something pop up before about how people from the Moira or Numurkah town or Moira local government area, how they can access support up and around that part to the north of Shepparton. The other few areas I thought we might touch on, Paul, is in relation to the messaging people will receive from the department, just generally how that process works, but in particular, what people can expect in terms of being notified regarding their day 13 testing.
Okay, so look, as you know, there are huge numbers of people caught up in Shepparton, but there are many more in other parts relating to the outbreaks in metropolitan Melbourne. So the computer systems have thousands upon thousands of people in them. So I think the first thing is understand exactly what we're trying to achieve. That the quarantine system is designed for public health. It's to protect each other during the incubation period of an infection. So most people have been in quarantine by virtue of the exposures at the schools since Friday, the 20th of August. And that day is the day where we call break of contact. That's when everyone moves away from the risk. And that's also called day 0. Now, the first day after day 0 is the day 1, the first day of a 14-day quarantine. Now, as you go through that, we come up to day 13, and that's when you should come forward and get a test. Then you wait until you get a negative result, and you still wait until the end of day 14. It's actually 11:59 p.m. on the 14th day. And after that, the quarantine order that is controlling you as an individual or a family is over, provided the test comes back negative. Now, so that's what we're all doing. The system is supposed to send you an initial text notifying you that you're in that position and that you must stay where you are. It's also supposed to remind you that your day 13 test is coming up. And then it's supposed to give you a clearance text to say everything's okay and release you. And it will work in most situations, but it's so far behind at the moment. There's quite a few people in Shepparton I know who are sort of halfway through, or well, they are halfway through, but it's Friday, the quarantine, and some haven't even received that first message. So there's hard work going on with the data people in Central to try and organise that. So in the event that it all works well, you would have received your first message. And it's to the primary close contact who are getting the messages, the person who's got the risk, or the parent guardian, obviously, when they're children. Then another message should remind you that day 13 is coming up, and then a final message should clear you and the household. But if that doesn't work properly, that's okay. We can do it for ourselves and catch up with the paperwork later. But what is really bad is if you break the system and go out, because we're trying to get rid of every single COVID virus in Shepparton so that we can actually have eradicated it for this won't be forever, but for this time around, so that we can all go back to having a great normal life again while we catch up at the national level with that vaccine target you would have heard about. So that's how it's supposed to work. But if sometimes it doesn't quite work, we can all understand and do it that way ourselves, and then feed back to the public health unit that you're waiting for your letter or you haven't heard. But don't stay home when you get to day 13 because you haven't heard anything, because we don't want to quarantine you for one day longer than you need to be. Now, if unfortunately during that time, someone in your house has developed symptoms and become positive for COVID, then all of the normal rules change, because your clock as a quarantine person has to start again when the case has actually been cleared of infectiousness, which is often 14 days, which typically is 14 days after the onset of their symptoms. So you can see how a few unfortunate people are going to get caught up for a bit longer, but the great majority are going to be releasable as I have just described. And now I've just seen a question, which is an often asked question. What if for some reason I can't get my test done on day 13? Well, don't get it done on day 10 or 11 or 12, because you'll be asked to have another one, because we're trying to get it as near as we can to the end of the 14 days, but still give you time to get your result. But if you miss it by a day, it really doesn't matter, because you do it on day 14 and we release you on day 15, or you do it on day 15 and we release you on day 16. But what we want you to do, we want everyone to be out and about as soon as possible. So that's why there's that emphasis. Must be day 13 or later. Now, there has been a story going around that if you miss your day 13 test, you have to quarantine again for another 14 days. Now, that's not true, except if you refuse to have a test at all. So there are a few people who don't want to have tests and just say, no, I'm not having one, which is your right. We can't make you have a test, but we can make you quarantine. So if you don't want to have a test at day 13, that's fine, but you won't get released for another whole quarantine period. So that's where that story comes from. But if it's just a matter of I didn't quite make it, it closed in front of me, don't panic, because you just get the test the next day and you're only delayed one day. Thanks.
Thanks, Paul. But again, just for everyone's benefit, we are spending a lot of time already on this day 13 planning, and our aim is to have people through on their day 13 as and when they fall due. There was one other question, Paul, in relation to stop and stay orders. Can you just provide just an explanation of what stop and stay means in relation to Tier 1, 2?
So stop and stay was a new category really for schools, because what we were noticing is when we found one case in a school, because there's so much mobility between children and students in schools, there often were many more, but we weren't always sure. So the stop and stay basically means everyone go home, assume you're going to be quarantined for 14 days, and we'll start testing the most high-risk people. And if we can find no evidence after a few days that there's any other people who've got any COVID, we may change the quarantine, which is a tier 1, to a tier 2. So it starts off at stop and stay, but you just assume, we may as well say, it might even be simpler if we just say, think of it as tier 1, everyone's tier 1, but we will get the first round of data from the first round of tests, then make a decision about whether we can actually change. So you go from stop and stay to tier 1, and then some lucky schools can, you know, I'm not implying that it's anybody's fault, but if we can find a school which is really, there's only one person and they appear to have got it from somewhere else and haven't had much time or any time to spread it, we can then change from stop and stay stroke tier 1. If you just think about it like tier 1, it makes it simpler and you don't have to worry so much about it. But it's just like the first thing you do while we're sorting out the problem. And just recently, Matt, you might want to mention again this, but at least one school, we have been able to do that, which then releases a whole lot of students. Instead of doing their whole 14 days, are being released about now, and the parents and the households can go back to work. Have you already discussed that in another forum today, Matt?
No, not yet, Paul, but
I'll leave that with you.
Yeah, I think there'll be another school that'll be released or have their classification reclassified as a tier into a tier 2 site. And really the short answer in relation to that is because the level of risk that the public health experts have determined in relation to certain changes in what's happening in relation to the outbreak as it occurs into that site enables them to have enough information to make good decisions based on what risk might exist, and it could allow those classifications to be flipped. So there may be 1 or 2 schools in the forthcoming days where the tier 1 classification would be reversed to a tier 2 classification, and that'll be communicated as and when that occurs. The other thing I just picked up earlier to mention is in relation to mobile testing. Mobile testing is available, and there is a process that correctly was referred to in the chat, but there's both a 1300 number and the 1800 675 398 number is how people can find out information about the in-home testing. I would say though, it's really got certain criteria upon which it's used for. It's not, it's because it's a precious resource we've got. It is available. We will use it when we need to, but we just try and preserve that for exceptional circumstances.
Matt, could you just repeat that number? A couple of people texting me would like to know. Yeah.
So we might have someone in the chat put that up in
put it in the chat. Okay, thanks.
Yeah, I think that'll, and then others can refer to it.
Thank you.
From there. So I think we've covered off a few things. So please, we've got a couple more minutes. If anyone's got a last minute question, please pop it up, and I'll keep an eye on the feed. But I might just go back to Merrin. I think it might be best just in terms of a summary of the available support that is for people in terms of in-home support, food packages and the like from there. So over to you. Thanks, Merrin.
Yeah, thanks, Matt. And just to be really clear that it's not just in Shepparton or the LGA of Shepparton, it is across the region, and anyone in Victoria using that 1800 number can access support. So Red Cross will deliver to wherever you are, and we also have, and so if you ring the 1800 number, if you're within this Greater Shepparton City Council, of course it will be provided through them, but if you're part of another local council, then absolutely that support will come through them, or Red Cross can support those deliveries. So please don't be concerned if you live outside that LGA. And again, John is about to put into the chat a consolidated list of the numbers and the emails and as well Greater Shepparton's phone number. So that's all about to go into the Facebook chat. But again, any council, wherever you live, regardless, please reach out and we can provide that support.
Excellent, thanks, Merrin. The other comment I noticed that came up was in relation to vaccination. So If you are required to be in quarantine, home quarantine, you shouldn't leave home to get vaccinated. You'll need to reorganise your appointment if you're required to be in quarantine. Of course, if you're not, it is one of the reasons you are able to leave your home. And we have plenty of supply of vaccines available for our hub. I know a number of other GP clinics and pharmacies are starting to open for bookings in regard to vaccination. So the best place, you can book your vaccination online at the coronavirus.vic.gov.au website. There's an online booking portal there. And you can also book on the same number that's been referred to as well, 1800 675 938. They can take telephone bookings for your vaccination. And just a message again, anyone who's not vaccinated yet, please make every effort you can to get vaccinated, because ultimately it's the only way we're going to get on top of COVID and stamp out this nasty virus. So I might go around the grounds in terms of the speakers and just see if there's any comments from Deb Abbott from an EMV point of view.
Thanks, Matt. Again, I can't stress enough really how important it is that where we access support and relief, that some of your own networks and where they are available, that's what builds resilience and over time, because as we gradually build that up, then it does allow a lot of those services that roll in for relief, for example, and being able to support people who are probably more vulnerable or have less contact with people who can support them. That means we can prioritise and get that relief needs to those people quicker. So if you do have support and you have family, friends available, please use that. But as Mirren said, where it is that you're really struggling or challenged, please don't, be afraid or be embarrassed to reach out. There's absolutely nothing wrong, and that's why all these services and why we're here. We're here to make sure that we can really serve you the best way we can. Just in regards to the ADF, some people have had not great experiences with military because they come from other areas. The ADF has been working with us, as I've said, for a long time, and particularly in this humanitarian area. We've always relied on them. We've always had them as a support agency for us in emergency management. If you are worried about uniforms coming to your door, please don't. And they'll always be working with volunteer agencies and/or authorised officers, always working together. They partner with us. They won't be working on their own. They partner with us. They're a support for us, and we're very grateful for their support. So take care, everyone, and we will get through this. Thank you.
Thanks, Deb. Paul, there's a question in the chat that keeps coming as a repeated question, but I think it's a theme nonetheless, is in relation to people that have been to exposure sites and they haven't been contacted, particularly it relates to schools. What should people do if they haven't been contacted by the department yet and they've been at one of those exposure sites?
So just a note that I can't put my video on. So now I've been given the chance to. So here I am again. There's definitely a process called self-referral. So you can refer yourself in and say, I was at this site. The most important thing is to follow the rules. So if you were at a tier 1 site, then you do the tier 1 rules. Then if you don't hear anything, you can self-notify. There's a couple of ways of doing that. Basically contact, I won't go into it because I'm not exactly sure of the right website, but you can self-notify through one of the phone numbers or you could send a message to the Goulburn Valley Public Health Unit, because you might already be there just waiting for a message, or you might have been missed. Now, if you're needing to apply for social support, in other words, money because you've lost your income, you will need to be registered. And once you're registered, you can then use the registration as access to $1,500 if you've lost income during quarantine. So the answer is you might just be having to wait, but if you're getting increasingly concerned, then let us know. In other words, self-identify, and we will then record you.
So I think on the Department of Health website as well, there's a self-assessment form, Paul. I think that's might be.
That's what I was trying to remember.
Yeah. So in some of my posts that I've put on Facebook in recent days, if you scroll back through that, particularly when in relation to one of the exposure sites, a hairdressing salon in Shepparton, we were encouraging people to use a self-assessment form in relation to that site because we had some concerns in regards to transmission and risk at that point. So if you, and I think someone's just popped it in the chat function, but that self-assessment form, if you go back through my posts, you'll be able to find it there. And then again, the 1-800 number. So I hope that's helpful. The other thing I noticed, there's some comments in there for people in relation to certain sensitivities in regards to members of our community concerning the ADF. That is something that's being worked through by the community engagement group and is a very serious issue that's being progressed in order to try and not present a threatening presence to people who may find that confronting, and so people are aware of that, and thanks for your feedback. Any last comments from Kay or Peter from council point of view?
Thanks, Matt. Get vaccinated, get tested, ring the 1-800 number, and it is a really good, the coronavirus hotline 1-800 number really is a good resource. It can take you in any direction and solve any of your problems. But if you can't get through there, ring the council number, as Kay said, 58329 700, and your local community will wrap their hands around you and do everything we can to help you.
All right. Thank you, everyone. I think we've got to the end of the questions. What we will do, in addition to posting the consolidated information, oh, sorry, Kate, was there something further? Okay. So in addition to the information being compiled into sort of one easy reference guide, we'll certainly post that into the chat function, but we'll also put that up on, I suggest, not only the GV Health Facebook pages, we'll share that with council as well so people can access it from a couple of different areas. So I think that's all. So again, thank you, Linda and Lisa, for your contribution in terms of the interpreting. Well done. I hope we haven't worn you out and spoken too quickly, but thank you once again. I think we've covered the main things. So as Peter just said, if you haven't been vaccinated, please go and get vaccinated. And if you've got any symptoms of COVID-19, get tested straight away and don't delay. And certainly if you've been to an exposure site as well. So we are really turning our minds, as I said before, to day 13 testing and being organised for that. As Deb also said earlier, I'm really confident that through all the great work many people are doing through their organisations and on an individual basis, we'll get through this. There is some light at the end of the tunnel, but we've got to keep working hard and doing the right thing. So thanks again, everyone, and have a good night.